Hello everyone, my generic name is Furosemide and Torsemide. I have brand names such as Lasix and Diuretics. My chemical names for Furosemide and Torsemide are
I am classified as loop diuretics. My pregnancy category as a furosemide is category C. Animal reproduction studies have shown adverse effects to the fetus, and there are no adequate or well-controlled studies in human. But potential benefits may warrant use of the drug in pregnant women despite having potential risks. As a torsemide, my pregnancy category is category B. Animal reproduction studies have failed to demonstrate a risk to the fetus, and there are no adequate or well-controlled studies in pregnant women.
In my mechanism of action, I am designated to block the sodium-potassium chloride cotransporters that are expressed along the proximal and the distal tubules in the nephron, preventing the transport of sodium ions from the luminal side to the basolateral side for reabsorption, resulting to increase water excretion and decrease tonicity of uric acid in the interstitium.
And I am binded to a chloride ion binding site of the transport molecule to reduce the oxygen demand in the medullary thick ascending loop of Henle by inhibiting the sodium potassium chloride pump on the luminal cell membrane surface. I am also known to have an effect in the renin-angiotensin-aldosterone system by inhibiting its flow after the activation of angiotensin II. And then, this will produce a secondary effect marked by the expression of aldosterone synthase reduction and aldosterone binding reduction.
I am absorbed in the GI tract about 60% of those after oral administration. However, food may delay my response. But don't worry, it doesn't affect or alter diuretic response. Wait for about 30 to 60 minutes and diuresis will begin. My volume of distribution is 12 to 15 liters and it crosses the placenta barriers. I am metabolized in your liver and excreted in your urine.
I am indicated for treating edema associated with congestive heart failure, liver cirrhosis, and renal disease, including the nephrotic syndrome, and for treating hypertension alone or with other antihypertensive drugs, and also when rapid and extensive diuresis is needed.
I am contraindicated to patients who have anorexia or a condition which your kidney do not produce urine. Also, to those people who have history of hypersensitivity to me, those who have hepatic coma and is in a severe state of electrolyte depletion.
I also have side effects, which are in the musculoskeletal system, I can cause muscle spasms, weakness, arthralgia, and myalgia. In your integumentary system, I can cause dermatitis, purpura, rashes, urticaria, itching, and photosensitivity.
In your endocrine system, I can cause hormonal changes. In your digestive system, constipation, diarrhea, abdominal pain, and discomfort is my effect. In your nervous system, I may cause dizziness, fever, headache, and restlessness. In your cardiovascular system, I may cause chest pain. I have great effect in your urinary system given that I am a loop diuretic. I cause fluid and electrolyte imbalance and extreme urination.
Before administering me to the patient, he must first assess if the patient have allergies to sulfonamides. Then, assess the cardiopulmonary status to evaluate the fluid movement and state of hydration. Next, ask the patient if they are taking digoxin for anorexia, nausea, vomiting, muscle cramps, paresthesia, and confusion, because it might increase the risk of hospitalization due to digoxin intoxication. And lastly, perform a thorough physical assessment to obtain baseline data before drug therapy to determine my effectiveness. When giving me to the patient, administer me orally in the morning to prevent frequent urination during sleep schedule. Monitor patient's response upon taking me by taking their blood pressure, serum electrolytes, and state of hydration to evaluate my effectiveness. And then, assess skin condition to determine fluid volume deficit or retention. And lastly, you may provide comfort measures to help patient tolerate my effect.
After administering me to the patient, explain frequency of initial monitoring and how reviews will be followed up and arranged. Inquire difficulties going to the toilet in time and disruption to sleep and daytime activities, since diuretics make people pass urine more frequently. And lastly, explain indications for my use. Never forget the things you have to know about me in order for you to be safe and will keep you from any complications and serious side effects that I can give. You also have to consider what other drugs I get along well, so you don't have to worry about what bad may happen. Always remember, you have a lot to know, so you are good to go.